class. All right. So I had a lot of questions come through regarding your week 2 EHR outpatient coding assignment. It's going to take all 3 of your books to complete this assignment. So what I've done is I've created a similar chart note that reflects the same codes and or the same types of procedures and by the provider. So I can walk you through in the book how you would access or how you would navigate to find each one of these codes. So I had a lot of questions about the diagnosis code, and I wanted to give a little bit of clarity on that as well. So I hope this helps. So I'll be splitting my screen, sharing my book, and then also sharing my mock chart note that I created. Again, this isn't exactly like the one that's you'll be reviewing inside of the EHR chart notes, but it is very similar in nature and we'll use the same codes. Okay. All righty. So let me get started here. Let me share my first screen. Now let me get my books. And again, you will need your ICD-10-CM, you will need your CPT manual, and you'll also need your HCPCS manual. So it's your little skinny book here, okay? Doesn't get a lot of love. You're probably only going to use this as far as in throughout your whole courses. You'll be introduced to this manual or this particular book once, twice during your time in the program. But again, it's pretty easy to navigate through, and we're really focused today just on the table of drugs section inside of this manual. Okay. Oh, hold on a second here. There we go. Okay. It's situated. Okay, there we go. All right, so I'm just going to read this note. Again, it's a mock-up note, again, to support you in your coding this week. So, patient John Doe. By the way, guys, before I even get started, what you're looking at right now is what's called a SOAP note. Okay, so we're referring to it as a chart note, office note, but the acronym for this type of note is SOAP. So what does SOAP stand for? What's that acronym? So the acronym is subjective, objective, assessment, and plan. Okay, so a SOAP note is broke down into 4 components. Okay, so an office note is broke down into 4 components. The S, subjective. In the subjective section of a chart note, okay, and I'm going to highlight this. This is the patient's own words, right? What they're presenting with. So this gives a little bit of history. And again, the patient is reporting that the pain is progressed over the past couple months, etc. So this is the patient's own words. We call this the subjective component. Okay. Then you have the objective component. Okay, so SOAP, SOAP. The O stands for objective, and that is literally the physician's physical exam of the patient. Okay, and then they document. So subjective, patient's own words. Objective is the physical exam and documentation by the provider. Okay. And then you have your A, which stands for assessment, right? So assessment is how, what that doctor, after doing a physical exam, has determined what the patient's problem or condition is, okay? So assessment, inflammation, bursitis, right glenohumeral joint capsule, resulting in chronic osteoarthritis. So again, the reason, right, why we only need to code for the osteoarthritis is because the condition of the inflammation and the bursitis has resulted in this final condition of chronic osteoarthritis. Okay. So I've also added in here secondary osteoarthritis of the right shoulder. Not that this is a secondary diagnosis. Okay. It's just that this osteoarthritis is a result of bursitis. Okay. So that's why we call it secondary osteoarthritis. So when we're looking up when we're looking up inside of our ICD-10 index, right? The key word is secondary osteoarthritis secondary. Again, not because it's a secondary diagnosis. It's just the name of this particular condition is secondary osteoarthritis. So SOA and then P. P stands for plan. So this is the part of the chart note where you'll be able to determine what the doctor has chosen to do to manage and treat this condition. Okay. So we can see that the plan is to administer an injection into the right joint to reduce inflammation. Okay. First action. And then what did we inject? So we injected triamcinolone into the right shoulder joint. Okay. Now, let me get rid of the diagnosis and procedure codes here, right? We don't want to look at that just yet. So what we have here is we have a injection into a major joint, being your shoulder joint. Okay. And then you have your milligrams of what was injected. So 20 mgs of triamcinolone. All right. Now, the rest of the plan is the patient needs to rest for 24 hours and then follow up in 4 weeks to assess pain relief and consider further interventions if necessary. So that part of the plan, right? The follow-up, we're not going to code that right now, right? That's a future plan. So when that patient comes back in 4 weeks, then we're going to code for that follow-up visit. All right. So again, just to familiarize you with what a chart note looks like when you hear the word or hear the acronym SOAP note, I want you to have a better understanding of this is a 4-part breakdown or deconstruction of an office note. So let's first talk about the inflammation bursitis, right glenohumeral capsule resulting in chronic osteoarthritis. So going from your ICD-10 manual, I would start at osteoarthritis, okay? To my O's, right? And then osteoarthritis is in the center column here. And what you'll find right off the bat is you don't see anything about chronic, right? So you got to think outside the box about this. So now what we've talked about was the bursitis resulted in osteoarthritis. So now we know we're not calling it primary, right? We're going to refer to this as a secondary osteoarthritis. So if we went over, keep scrolling here. You got your hand joint, knee joints. Then you got post-traumatic, primary. There's primary shoulder. Flip over to the next page, and then it starts with secondary osteoarthritis. And then you'll scroll down till you see shoulder, and then you're going to find M19.21. Now, already given us some clues here. It's got a dash and a stop sign, so you know they got to want more from us. So what else could they want? Oh, how about laterality? Yeah. How about the right shoulder joint? So now I'm going to take this over to my M codes. Flip over till you get to M19. Again, always getting in those good habits of checking out your category notes first. I don't see anything specific. It just has an excludes one note. So if it's polyarthritis, they're telling you that you're not going to code from this category. Go look at category M15. Excludes two. Remember that if your patient has one of those three listed diagnoses, you can report that in addition to a code from category M19. That's what excludes one. Mutually excluded, never reported together. Excludes two notes means that a patient can have one of the following conditions, plus report a condition from your M19 category. Okay. Then we come down till we get to M19.2. Okay. Secondary osteoarthritis of other joints. And then we get to secondary osteoarthritis, right shoulder. So M19.21, the one represents the shoulder. M19.211 represents the right shoulder. Okay, and that's the only diagnosis that you're going to use for your EHR outpatient coding. All right, next, let's talk about that plan. So the first part of the plan is the action of an injection, okay? So if you went over into your index under injections, I was actually able to find it by going under injection, and then I went to go look at bursa, since they did mention the patient had bursitis. And then I found a range of codes: 20600, 2064, 05, 20610, and 20611. Since I'm over here, I was also thinking that I could probably go over to joint as well. I didn't see anything that was specific to the shoulder. Let's see here. Let me just triple check myself one more time. Salivary gland. Oh, here we go. When I saw shoulder, they only had something about arthrography, radiological, and that's not what we were doing, right? So we've got to narrow it down and just take it to, again, your glenohumeral joint, which is your shoulder. And then this is another way that you would still need to research those same codes that we found from the previous page. So I'm going to go over there. All right. 20,000 codes. Again, those are going to be your musculoskeletal codes, procedure codes. And then little details here. Again, they give you a range of codes. So once you get over, you have to determine which one is the best fit for us. So 20600, that would be into a small joint. And then it even gives you examples like fingers and toes. Your shoulder is a major joint. So if the parent code, right, doesn't fit, then the variation isn't going to match either. So you just keep on moving. 20605, aspiration and or, right? So it could be either one of those things. Injection intermediate joint or bursa. And then again, it gives you examples of what an intermediate joint is. So if the if the parent code doesn't fit, then your variation, we can skip right past it. You got to think of this like a parent-child relationship, okay? So there's a relationship with 20606 with 20605. That relationship starts at where the semicolon begins, right? So the relationship, again, always remember that semicolon is anything before that is your base or parent code, and then anything after that is a specific type or variation of that base service. I like to just call them parent codes and child codes. You do what works for you. So base code, variation, parent code, child code. All right, then next up, 20610, arthrocentesis. So arthrocentesis, that term literally is to inject or to aspirate. So you're either you're injecting or inserting a needle to withdraw fluid, or you're inserting a needle to inject some type of substance into that joint. So now we've got 20610, arthrocentesis, aspiration, and or, right? So it can be one, it can be both of those or one or the other, doesn't matter. Major joint or bursa, that's another little key thing to look at, right? All of these little and ors, and then it gives you an example. Shoulder, hip, knee, subacromial bursa without ultrasound guidance. Nice. So now you've got your procedure. So the procedure of inserting the needle to administer a substance, right? So this is just the injection component. Now we need to tell the story of what was injected, okay? And that's where your HCPCS manual comes in. So from your HCPCS manual, now again, this is just a quick little tutorial on this manual. It's pretty self-explanatory. It's very simple to use. Not a lot of like guidelines and rules and additional, things that you have to, follow to get to what you're looking for. So pretty much you just go to the word you're looking for inside of the index, which is at the beginning of your manual. Or you can, as you get to know this manual, you'll be able to jump right over to that particular section. So I decided I wanted to start you off first by just going to your index. What did they inject? They injected triamcinolone. Okay. So now I'm going to look for this range of codes, J3301 through J3303. Okay. So in your HCPCS book, everything is alphabetical. Okay. And then I'm going to go to my J codes. When I think J codes, and when you think J codes, I want you to think injectable drugs. Okay. So injectable drugs, other than chemotherapy drugs, okay, is J0100 through J8999. This will always be the case. So anytime that a doctor performs an injection, okay, you're going to have two codes. You're going to have one for the administration of that substance, and then you're going to need to have a code for the substance that was injected, okay? So now we've already been told that it's J3300, or that's our starting point. Now, the one piece of information that I'm looking for as well is we need to find the appropriate milligrams, right? So if you don't find 20 milligrams, what you'll need to do is you're going to need to include an additional unit to cover this, to cover that additional 10 milligrams, okay? So now what we have is now we're going to go over, this says 10 milligrams, and something else that wasn't clarified is how it was, they're not telling us from this section the method of administration. So we know the method of administration was intramuscular. That abbreviation is IM, okay? So we have a pretty good start here, okay? And now there is another section in this HCPCS book that's going to list all drugs and the code, to apply based on the method of administration. This is in the table of drugs, okay? This is your HCPCS book, and your table of drugs starts on page 45. Everything is alphabetical. So now I'm going to go over LMNOP. Got to sing the alphabet for a second here. To T for triamcinolone. Oh, Nice. I highlighted it for myself. All right, look at that. Now, dosage column, method of administration, and then the appropriate HCPCS code. So we're going to use triamcinolone, right? Find the appropriate method of administration. You want everything to match. And then it says per 10 milligrams, IM J3301. So because there is no triamcinolone that has 20 milligrams, this is where you're going to add 2 units. So your final code answer will be the J3301 times 2, 2 for 20 milligrams. All right, guys, I hope that was helpful and you got an introduction to your third book. All right, so more to come. I hope this was helpful. And again, if you have any questions, always feel free to reach out. I love to talk billing and coding and support my students. All right, guys, you have a great rest of your day, and I will see you in the next episode. Have a great day.